I kind of wanted to start with like definitions and statistics that, brace yourself, are horrible. So like the definition of maternal mortality rate by the CDC is dying while pregnant or 48 days after. There's been efforts to extend that to about a year after, but I'm not sure how aware you are, but this is like a very big problem in America.
Texas, right?
Yeah, especially in Texas, but also in America. So we are 46th in 181 countries, not being great at this problem.
Oh.
And it got a lot worse after the pandemic. Like we were at least aware of it before the pandemic, but it got increasingly worse. So in 2000, every out of 100,000, every 9.8 people would die.
Of 100,000.
Yeah,
Of women who were pregnant or within 48 days of.
Right. Yes. 396 people. And then in 2020, the number went up to 23.8, which is about 168 people. Now this is 2 times worse for people of color. So that to 23.8 is closer to 50. And it's interesting fact because it was safer to be pregnant and having kids for like my mom and my grandmother
Than now?
Wow. In America. Yes. So the in between 1955 and 1985, we decreased maternal mortality rate by 99%. And then we just
Between which years? 65?
55 and 85.
30 years.
Yeah, so let's see, and this is a lot of numbers, but 4 out of 5 are preventable, are considered preventable of those deaths. Now, in Texas,
Great state of Texas.
yeah, the great state of Texas, so the last report that we did was in 2015. There's a new one that's supposed to come out, but it's been delayed and it's causing drama. It's supposed to be out by now. So in 2015, which, let's kind of remind you, in 2020, it was 23.8 for every 100,000
In Texas.
in America. So turning back the clock another 5 years for the last numbers we had for Texas is 18.4 for every 100,000. So we're expecting that to be much higher for this
Been
upcoming.
23.
Yeah. So any questions out of all that information?
So the last Texas statistics are like 2010,
2015.
2015. Okay.
Yeah.
At that point, the U.S. was 13, right?
We only have,
It's not important.
yeah. Well,
How are you going to get to the causes?
What, yeah, I would like to ask. I don't mean to derail where you're going. I assume there's some kind of linkage between maternal mortality and infant mortality.
Yes.
Okay, you don't have to go into that if you don't want to.
Yeah. I'll come back to that.
Yeah,
But the numbers aren't great, but they're better. And I don't have those numbers on my right with me. But so the causes are, the most top 3 causes are blood clotting in lungs, hypertension, so very high blood pressure, and loss of blood. So that covers things like preeclampsia and a whole list. So one of the highlighted differences between our country and other developed countries are we have a higher C-section rate by a lot. They say one of the reasons for that is because in our healthcare system, we default to OBGYNs when it comes to birth care, which most countries actually default to midwives. And then if you have complications, then you'd be given an OBGYN. So the kind of idea is that if you give someone a hammer, everything looks like a nail, and surgery and C-sections comes out of that decision. Another different thing, obviously, is our healthcare system. We spend more than any other country on healthcare per person, but it is not widely available to everyone, and it is expensive. And I was talking to a friend in Italy this summer, and I asked her she has 2 kids. I asked her how much it was for prenatal care. She said about $50. She gets, and if you have complications, it's more, but not crazy. And she had a midwife, and she had parental leave afterward, and really didn't have any complaints. So let's see. Any questions from any of that? Any comments?
It's tragic. It's tragic that our industrial capitalist healthcare system, works so poorly for so many people in so many ways. And it's so deeply rooted.
Yeah.
My wife had 2 children, and the first one, she was working in hospital time. She worked with the best OBGYN there, and he wound up inducing labor. Turns out he was leaving for vacation 2 days later. Had to deliver the baby with forceps, and it was not a pleasant experience, to say the least. Second child, she worked with Booth's Maternity Center, which was alternate care with midwives in charge and doctors just on standby. It was just a whole different, wonderful, loving experience. Just shocking how different those 2 births were.
if you could talk about one specific cause, one main cause of this, what would your thought be?
Actually, a good amount of studies on why this is happening, including Texas did its own review. And the main huge outlier was listening to women.
Oh,
Listening to women are people who are pregnant.
So are most of these women actually getting prenatal care?
I'm not sure, but that's a good question percentage-wise, but I would assume so, yes. There is not a lot, let's see. Most of the complications come farther along in pregnancy. And things that are on top of this list happen farther along in pregnancy and aren't really related to too much about prenatal care. Does that make sense?
I would have thought diagnosis if it was actually gonna come up, you know. If somebody's seeing you at 8 months pregnant, they should be able to tell whether your blood pressure's up.
Oh, yeah, that is 8 months, yeah. And by then you would be doing hopefully like urine tests for preeclampsia.
Right.
But let's see, coming back to the people of color and how worse it is for them. So there's this theory that's been around for a while called weathering. So the idea that all the microaggressions and just living in America messes with your health. They're finding that this is actually affecting pregnancy for people of color. And it is directly linked to actually having smaller babies, which if the idea is that all that stress is reducing nutrition to the fetus. And if the baby is smaller, it has less likely to thrive afterward. So that it kind of goes to the infant mortality as well. Did you have a question?
No, it's just my jaw dropping.
Yeah, no, it's a crazy thought. So how they even studied this was they had Africans who had migrated to America, and the birth weight of those babies was considered normal. By the first generation of their kids, the birth weight of their babies had decreased. So just one generation of being in America affects your biochemistry. So that's crazy to think about. But also going back to like the reviews on preventing maternal mortality, the biggest one is listening. So there's also a problem in just about general consent. There's plenty of stories out there of like not knowing the name of the doctor in between your legs and not being told what is being done and not giving consent for forceps or something. And there's I don't know if you've heard about Serena Williams' story about giving birth. It was very, yeah, got a thumbs up over there. It was very eye-opening for a lot of people. So this is a very successful, educated, athletic woman who knows a lot about her body.
Affluent.
Yes,
And very wealthy.
Yes, very wealthy.
Yeah.
And she has a history of problems with blood clotting. So yeah, blood clots. So I mentioned that one of the main causes is blood clots in the lungs. So she told one of her nurses that she was experiencing what she knew to be a blood clot. And they didn't listen to her. And they thought she was being silly. And she almost died. And she had to advocate for herself to get them the medication she knew she needed, like she knew the name of it and everything, and help her out. So very unacceptable. And I'm not going to get the numbers on this right, but someone with a white person with an 8th grade education is more likely to survive than a PhD Black woman.
So being able to afford the best gynecological care the money can buy is not a guarantee.
Yeah, or that prenatal care you were
Or
talking
prenatal.
about. Yeah, because it's a very common response to hear the maternity mortality rates and think, oh, they must not have support. They must not be educated in how to take care of themselves. But the raw data shows that's just the color of their skin. And that can be very hard for doctors to listen to, that they have this internal bias, especially because they've been trained to, they're right all the time, which can be very helpful, but also detrimental. They also have been doing this because they like what they do and they like saving lives and helping people. The idea that they're treating someone differently, even without their knowledge, is unthinkable. So that internal bias is very strong and embedded into the system that they were taught into. So there has been training and attempts to fight that. There's a particular story of a birth story of a woman in New Orleans. Her previous pregnancy was a stillbirth. She was very nervous about this pregnancy, so she hired a doula to help with that communication barrier. Consent was non-existent, even with the doula there. They referred to her last pregnancy as a demise and were very insensitive about the fact that she had lost her previous child. And everyone in that room, except for the doula and the patient, were white in New Orleans. And it ended up okay, but the experience was not acceptable. Any questions, feelings? Just a check here.
So, for instance, that would not have made the mortality statistics, but it wasn't. It was a really bad experience. So how many? So if you take the mortality statistics and you kind of extrapolate, you probably are looking at a huge number of them.
I should mention she almost died
Okay.
on her previous birth as well. She almost bled out. And so that also made it more traumatic. But that does come to a good point of getting better at having accurate numbers. So in the last Texas one review specifically, it outlines getting better at tracking births and recognizing when it is maternity mortality rate and just overall paperwork to making sure that's accurate and getting better numbers. Like that was also one of their top recommendations, to making sure we have the right data.
So that, I guess that then brings up a further question. Just thinking of people who don't die, women who don't die, but so the mortality rate is like maybe a tip of an iceberg of a greater maternal health issue.
Yes, yeah.
I mean, and so do we have any measures for that, or is that not, is that not as easy to, obviously it's not a black and white thing, cut and dried thing.
I would say it comes still back to listening to pregnant people, especially during pregnancy, because you'll have like a patient-doctor conversation that'll go something like, oh, I have really bad headaches. And then they'll say, well, sometimes we ask the pregnant person to suffer a little bit for the infant, and I'm not going to give you any medication. Or look into maybe that's hypertension of why you have a headache. Or thinking she's being hysterical, which in its definition of hysterical is very problematic. It's consider like the Greek mythology of the word hysterical means being crazy, like from the uterus specifically.
Are there any conclusions about or studies about differences between Texas, which is 46th, and whatever state is first, second, and third? What's so different?
We did not expand Medicaid or Medicare. So yes, Medicare.
So we neglect the poor, the people who need services the most, much more than most of the other states.
Exactly.
That's
So
Texas, okay.
that was actually another thing they had in the review was better comprehensive sex education, and expanding Medicare, and what was another one? It'll come to me. But yeah, I don't remember. I don't think this was Texas. I think this is one Medicare directly. But it used to be a few weeks after you gave birth, you stopped getting any aid for Medicare. And they expanded that.
It's got to be Medicaid. Medicare is for people over 65.
Thank you. I get those mixed up all the time. So they expanded that to a year, and that's helped.
It's almost a paradox there, though, that people who have the most intensive interaction with our industrialized healthcare system have the most C-sections and probably the medical team that pays the least attention to them if they're persons of color. And yet the fact that they have so little access to general health care leads to these terrible outcomes.
Well, and we're not, so when you value a person, or easier to believe that they are in pain. We don't do that with women, because we historically and currently don't believe them or have as much compassion when they are in pain. That is doubled quite significantly if you have a lot of melanin in your skin. There is still a very concerning theory that people of color can take more pain. They need less medication. They can handle more. They can go squat in the field and give birth and they'll be fine. And that's still a problem, unfortunately.
Anything been done? Is it common at this point to allow a patient advocate, whether it's a husband or a friend, in the delivery room?
Yeah, so doulas.
A doula, yes, but I was reflecting. I have two children, neither were born in the United States. And they were both born in hospital settings. But for the first birth, my husband Stuart was with me. And for the second birth, he was out of town and I'd been staying with a friend. And they weren't going to let her into the room because she wasn't my spouse, and she wasn't my mother or my mother-in-law. And she said, but none of those people are here, so you need to let me in.
Yeah.
And she's the person who said, oh yes, I can see the baby's hair, when nobody else was telling me what was going on.
Yeah, it definitely helps to have someone there. And that was also a problem during the pandemic. Was they were reducing. There was a lot of people giving birth alone.
Did the use of doulas change during the pandemic?
Yes. So a lot. It was hospital by hospital basis. So sometimes you had to show your certification to get through the door. Sometimes you weren't allowed at all, and there was a video conference substitute. And sometimes it was completely fine as long as everyone wore a mask. But it was pretty messy, to say the least.
How does insurance factor into all this?
New York City will, I'm not sure what the logistics are of that.
The city somehow does it though.
Yeah. And that was their effort to try to fix this. There might be some insurances that will assist with that as well. But when it comes to if you want to have a non-hospital birth, normally have to pay for that out of pocket, sometimes even the midwife. Let's see, the actual cost, even with insurance, of giving birth varies a lot, but it's safe to say it's thousands of dollars. Do you remember how much you paid for your birth?
One of them was National Health in England, so next to Scotland, next to nothing. The other was in Australia, and we had insurance, but the American insurance company wasn't a health insurance mainly in Australia.
Yeah, it probably didn't check all the boxes. Yeah.
So it was, I don't remember what it was. Maybe we're talking 45 years ago.
Yeah. So my grandmother paid $300 for her birth, for giving birth to my dad and my aunt. And she stayed in the hospital longer. She had a C-section. And that is unheard of now. Oh, sorry, that was a head.
Wow. You mean staying in the hospital longer?
Yeah.
Yeah.
They get you out in a day.
So that also brings into the fact that we don't have family leave afterward, and there are plenty of people who have to start walking around with having had severe abdominal surgery way too soon.
Is there any statistics or evidence of the maternal mortality rate differences between people with C-sections and with vaginal birth?
Yes, that's one of the chart, and you see how many C-sections America does and how many the other ones do. It's very obvious that there's a parallel to that.
You would think that would get through to the OBGYNs, that the more C-sections they do, the more likely the increase in maternal.
Yeah, I think there also difference between that is other countries are more likely to use midwives.
Right. That and OBGYN.
Yeah, and giving birth takes a long time. And not every doctor likes that. I would be, one of the questions I've been having recently, just to kind of show my thought process on this, is right now, if you have a checkup and you find that your baby is breech, so its feet are down here, and you're advised to get a C-section. Which makes a lot of sense, and the outcomes are better, but I'm curious about how other countries do that. Because one of the reasons why they suggest that is because we don't train, our OBGYNs don't train how to give birth, like help with the breech birth. So they're doing what they were taught. Which I find interesting. Questions?
Lots of feelings.
So in that case, are they even given a choice to have the baby breech if they want to? Or it's like, well, we're not trained to do that. You have to get a C-section.
Choice can be a very fuzzy thing, so they can be scared into having a C-section. Honestly, with the information that I have now, I want to do more digging, but I don't want to give birth vaginally to a breech baby if no one knows how to do it.
So you would choose the C-section.
Yeah, unless maybe there was a midwife who had told me she gave birth to so many, because midwives are normally taught how to give birth to breech.
Typically, how, or maybe there's a big variation, but how soon before the actual birth is that choice offered?
So let's see. I have someone in mind, and she's about a month out from her due date. And her baby's breech right now. So there's talking about a C-section. They don't, so the full term is 40 weeks. And they'll normally choose a date close to 40 weeks to induce you if you haven't given birth by then. So there's a timeline they're working on.
So it's not necessary. I mean, I have this stereotype of, it's the last minute and the person, the woman giving birth is all drugged up because they've given her all these pain meds and they give her the choice then. That's not typical.
Well, so the pain options are either an epidural, which those drugs don't reach your head. They just numb
Gotcha.
your body. So you normally have a pretty good cognitive communication going on. They did twilight births, which we don't do those anymore. That's a lot of medication and it ended up not going very well.
Wait, what are twilight births?
You would drug the pregnant person quite a lot, and you'd do forceps because there wouldn't be a lot of pushing, and the pregnant person would come out not remembering anything really.
Wow.
Oh, okay. Thanks.
Yeah.
Wow.
Interesting stuff that's going on. With the reproductive rights thing. So right now, if you have any birth that you don't want, pregnancy that you don't want to have, you have to go out of state. That also applies to any complicated pregnancies that are wanted and are not going to make it. So you have to get on a plane and go through this dangerous process of flying to another state and getting an abortion. Last time I spoke, I had some articles that I shared. I can do that too. There's a good book that I'm reading right now called Under the Skin, which is specifically about people of color and this problem. She's the journalist who covered that birth in New Orleans I was talking about. And after that, she wrote a whole book. But yeah, it's a messy problem.
So, Bree, I don't know, this is a little bit, maybe off topic, but maybe not. We probably should have done this at the beginning of the forum, but would you care to talk about how you have come to have this knowledge and expertise and passion?
I am a doula. I've always been very interested in birth stories. My mom had 2 home births, and my brother is quite younger than me, so I was there for his birth, and I kind of got the bug from there. And then after college, I did my classes. I don't need any really official certification to be a doula. Doula translated just means servant. So you're being a servant to this pregnant person. I should also point out I'm using pregnant person because not only women can give birth. So I also was very disturbed by the fact that our maternal mortality rate was so ridiculous, and I have no desire to go into any like medical field. So being a doula and being a support system and helping deal with the pain and birth and stuff was just up my alley. So that's the way I try to help.
So give me the distinction between a midwife and a doula.
Yeah, good question. So doulas do nothing medical. We are there to emotionally support you, make you comfortable as we can, and deal with pain in any way that you like. I've had clients that have an epidural, but I am still there. My job is not to advocate for them, but teach them how to advocate for themselves and be there to support them as they do that. But my job is to be there and hold space for them. And that's also including their partner. The advantage of having a doula and a partner is the doula's done this quite a few times.
The doula's what?
Done births quite a few times.
Yes, that would be useful.
Yeah. So there's still what my teachers like to point out that men have not been in the birthing room for very long when it comes to the whole human experience. So there's a long history of women supporting women in childbirth.
So do you work for an organization or?
There are a few collectives. There is a good organization in Austin called GALS, which is an acronym. I can't remember.
What was acronym?
Yeah, and their whole goal is no one gives birth alone. So they're on call, and nurses know about them. So they can call GALS and be like, hey, we have this person here alone. And there'll always be someone on call to go to any hospital to.
So it might be a first time meeting.
Yeah.
And so do you work full time in this field?
And I prefer that mostly because my last birth that I did was quite a while ago, and it was so long. It was, I think I blocked the actual number, but it was like 20 hours or more. And I consider myself a very empathetic person, and that took forever for me to bounce back. I also am a caretaker and a lot of other things. I help take care of my dad who has dementia, and I just need to guard myself.
Yes.
And I like that I can more like focus on the person, and I have more to give if I don't do it full time.
Sure. Wow. What a calling.
Yeah, no, I definitely have colleagues who do a crazy amount of births, and I don't know how.
Does insurance pay for doulas?
So New York State does help pay for doulas. I'm not sure how that system goes. I have Blue Cross Blue Shield, and I don't think they do. But there has been efforts to try to change that.
Medicaid?
Is the doula support through all the prenatal care or like the birth itself?
normally birth stuff and postpartum. There's also doulas that are specifically for postpartum. There's even doulas for abortions, just to be there and support you. A doula can be there for C-section. There's a lot of parts of pregnancy and birth that doulas can be a part of. There's even doulas specifically that go into our prison system. Yeah. I know Gals does some of that.
I'm glad to hear about that because I know that those in the prison system are not acknowledged for having pain.
Yeah.
At all. Yeah, for, tooth extractions to urinary tract or whatever. So much less pregnancy.
Yeah. It goes back to the correlation between us thinking someone's human or more likely to believe they're pain.
Right. And that goes for men and women, in prison. So.
And different topic, but I feel that if you treat someone like an animal, which I feel like our prison system does, you will react animalistically and very angry. And I think they have every right to.
What you said about the time you needed to bounce back, that stood out to me a lot. So yeah, thanks for saying that.
Yeah, we, at my work, I'm lucky enough to have, we have a, like, sorry, I'm missing a word. Caretaking community that we all kind of like lean on each other and be like, paperwork for this is horrible. Our government sucks. And stuff like that. So it's nice to have a caretaking community.
Well, we talk about the length of these births. My sister was like 36 hours. She looked like she'd been beat up by the time she got finished with it, much less the people who were caring for her, But a lot of those, the nurses were able to do shifts and come in and out, but a doula doesn't get that.
Yeah. Well, I do have the backup.
I had a pregnancy. I've only born one child that ended up in a cesarean, but it was a 48-hour labor. And that was really hard to recover from. And people expected me to just come back right away. So it was really hard to deal with. We don't give a lot of respect for, for some people, childbearing is, really a very easy process, but for some it isn't. And I was very lucky to have a lot of support during that time. I was a La Leche League leader at that point. So I got a lot of support from that community. I didn't have a doula or I had a decent doctor, but unfortunately he was out of town. So that's how that happened in a rural hospital.
That I don't remember the exact numbers too, but most pregnant people give birth and they don't know the doctor that's in the room, just because of the system and how it works, and if there's a backup or who's on call. Katie McNeil and all of them. Mm-hmm. They recently had a new baby, Lucy, who I met a few weeks ago. Her birthing experience here at Seton, Maine was very different compared to Memphis. She does not recommend giving birth in Memphis, which does have a high population of people of color.
Yeah, and it was difficult when she had their first pregnancy because the pandemic had just gotten started and then they were kind of stuck, like, well, yeah, how do we do this? And a lot of trouble getting her husband in.
Yeah, and she was also is a medical professional. Yeah, and it was like, what are you doing? It looks like we're coming to an end. Yeah.
Well, thanks, Bree. And I hope we get to continue this at some point, this speaking.
Thanks for listening. I know it's a hard topic.
It's a hard topic.
Yes, it is.
Disillusioning that things can get worse than this.
Yeah. Yeah. I'm jealous of the generation who could give birth a little safer.